Thank you, Nina. And what an amazing community you have helped to create here. It's such a pleasure to get to be part of it. And thank you to Terry for an introduction that nobody could possibly live up to, but touches my heart. I know I will be a little distracted today thinking about Terry, and I know that many of you join me in sending our love and very best wishes for a speedy recovery. As a kid, I was that super annoying child who had learned the joys of the why game. Why is fire hot? Why don't I have wings? Why do I really need to do my homework? My mother's a social worker, and my father is a theoretical physicist. And the more I asked why, the more interesting and sometimes strange and unpredictable the answers became, which did nothing to wean me from the habit. The obsession with trying to understand root causes has stuck with me to today. 30 years ago, almost exactly, I finished medical school, took the Hippocratic Oath, and drove across the country to here, to San Francisco, to start my career as a physician, a healer. When I started, I had no idea how big and complex my patient would ultimately become. I remember as a doctor at San Francisco General Hospital seeing patients again and again with the same conditions. People without homes who developed pneumonia, IV drug users with cellulitis, alcoholics with hepatitis and pancreatitis. And I became increasingly uneasy that I was doing nothing to address the root causes. I went back across the country to the School of Public Health to move further upstream, to learn how to think about the health of whole populations instead of individual patients, to think about prevention instead of treatment. I was impressed by the power of vaccine programs and prenatal care, providing nutritious diets, seatbelt laws, and smoking cessation programs. But again, I felt uneasy, because all around me I saw the core conditions for health eroding from our destruction of our planet's natural systems. I began to wonder, can we even have healthy populations on a sick planet? This interest in root causes and how Earth's natural systems play a foundational role in protecting human health has taken me to the field of planetary health. We find ourselves here, gathered together, at a truly unique, I think, moment in human history. By most metrics, there has never been a better time to be a human being. The past 75 years have seen extraordinary improvements in most measures of human development. Since 1950, the percent of adults who could read and write globally has risen from 42% to 86%. The percent of the global population living in extreme poverty has dropped from 62% to 10%, despite a nearly tripling in the human population. Life expectancy has risen from 46 years to 72 years, and child mortality has fallen by a factor of 4. But the same truly extraordinary scientific and technological developments that have fueled almost unimaginable improvements in global human development in really just one person's lifetime, coupled perhaps with a strain of human exceptionalism that allows us to believe that we are separate from the rest of nature, are driving a massive ballooning of our ecological footprint and degradation of most of our natural systems. In order to feed ourselves every year, we've appropriated 40% of the terrestrial land surface for croplands and pasture. We use about half the accessible fresh water on the planet, mostly to irrigate our crops. We've fished 90% of monitored fisheries at or well beyond maximum sustainable limits. We've cut down about half the tropical and temperate forests, dammed over 60% of the world's big rivers, and we're suffering from a growing problem of air, water, and soil pollution. As you all know, we're disrupting the global climate system. And all of these interacting, human-driven environmental changes are driving species extinct at about 1,000 times the baseline rate. The population sizes of mammals, birds, reptiles, amphibians, and fishes that share the planet with us has dropped by over 2/3 since 1970. Roughly 1 million species face extinction, many within the next few decades. These are deeply upsetting trends, a chronicling of an unparalleled assault on nature. And while many of these trends will be familiar to you, what may be less familiar is what they mean for human health. The core premise of planetary health is that the scale of humanity's ecological footprint now exceeds our planet's capacity to absorb our wastes or provide the resources that we're using sustainably. And as a result, our collective actions are transforming not just the climate system, but biodiversity, land use and land cover, our biogeochemical cycles, global scale pollution, and scarcity of resources like fresh water and arable land. And all of these large-scale, human-driven environmental changes are interacting with each other in complex ways that we're just starting to understand to affect the core foundational qualities for human health. The quality of air we breathe, the quality and quantity of food that we can produce, water quality, our exposure to infectious diseases, our exposure to extreme weather events, even the habitability of some of the places that we live. And as a result, we are seeing impacts across every dimension of human health, from nutrition to infectious diseases, to the non-communicable diseases, to population displacement and conflict, to mental health. Just as we have come to understand over the last few decades that there are important social and cultural and political determinants of human health, we're now coming to understand that there are critical ecological determinants, that indeed our health is nested in a set of biophysical conditions, and that we are now transforming those conditions at the fastest rate in the history of our species. So, how do we connect the dots between those biophysical changes and the health of whole populations? Let me give you just a couple of quick examples from my own research. The first example is our work to explore the direct effect of carbon dioxide concentrations on the global food supply. By growing staple food crops inside these rings of carbon dioxide emitting jets, and growing identical cultivars of the same crop inside and outside of these rings, we can maintain the CO2 concentration inside one of these rings at a prescribed level. In the case of our experiments, it was 550 parts per million, which is where we expect the world to be about the middle of this century. Using this type of what's called FACE, or free air carbon dioxide enrichment methodology, we can isolate the effect of CO2 on the plants themselves, where they're all experiencing the same open field conditions, the same weather, the same soil types, the same exposure to pests and pathogens. The only difference is the CO2 concentration. And doing these experiments with agronomists all over the world, we grew 41 cultivars of 6 staple food crops on 7 locations across 3 continents over 10 years to build a large data set that allowed us to really answer this question about whether rising CO2 was affecting our nutrition. What we found was that indeed there's a very significant impact of rising CO2 on crop nutrients, particularly nutrients like iron and zinc and protein, which are extremely important sort of foundational nutrients for human health. Over the last several years, our team has been doing work to actually identify what are the human health effects of these changes in nutrients. How will they affect the health of 152 different national populations all around the world? And what we've found is that the direct effect of carbon dioxide on the crops that we consume is likely to push between 150 and 200 million people around the world into new risk of iron and zinc and protein deficiency, in addition to exacerbating the existing deficiencies in about 1 billion people. So these are very large global health effects. A second area where we do a lot of research is on global pollinator declines. And working with pollinator ecologists, we learned that we can actually quantify the global yield gap, the amount of crops, pollinator-dependent crops, that are not being produced because we don't have sufficient wild pollinators to produce them. We can model how those crops would have entered into the global food trade system and who would have purchased and consumed them and what would have the health benefits been. And it turns out that several pollinator-dependent crop types are extremely important in protecting us from certain kinds of diseases. In particular, fruits, vegetables, nuts and seeds, and legumes all help to protect us from things like heart disease, strokes, certain cancers, and diabetes. And what we found when we modeled the effect of insufficient wild pollinators is that we're seeing about 500,000 excess deaths every year because we don't have enough pollinators around to optimize the yields of the crops that would protect us from those diseases. We also found in a series of case study countries that we looked at, like Nigeria and Honduras and Nepal, that between 12 and 30% of the economic harvest for the entire country was lost because of insufficient pollinators, and that represents a very significant share of the total GDP of some of those countries. So there's significant economic costs of not having those pollinators present as well. Of course, these are just the tip of the iceberg, just two examples of how environmental changes are affecting food and nutrition. We also work on how overfishing and ocean warming is affecting access to wild harvested fisheries, and we found that about 1 billion people around the world depend on those wild harvested fisheries to get adequate intakes of critical nutrients. We've shown that wildlife population declines are affecting nutritional sufficiency for subsistence populations that depend on wild harvested bushmeat to achieve nutritional sufficiency. Water scarcity and land degradation are creating further constraints on producing enough food at a time when we need to dramatically increase food production to keep up with global demand. Pollution, particularly ground-level ozone, is a potent plant toxin and actually reduces the yields of crops that are very, very important for human nutrition. And of course, surprises. If we sat around 15 years ago and thought, I wonder how adding carbon dioxide to our atmosphere will affect our health, we probably wouldn't have come up with, it'll probably make our food less nutritious. And as we change all the biophysical conditions around the planet that we have evolved to live under, we will continue to experience these surprises as changes move through very complex systems to affect the overall food production system. And of course, there are many other dimensions to human health besides nutrition. Each of them is being significantly threatened by global environmental change. For example, deforestation, dams, and changes in temperature and precipitation are changing the risks of vector-borne diseases like malaria and schistosomiasis all over the world. Pollution of air, water, and soil causes about 9 million excess deaths a year, mostly from non-communicable diseases. Population displacement continues to set new records every year, with environmental collapse as one of the key drivers. And ecological grief and eco-anxiety are contributing significantly to a mental health pandemic, especially impacting indigenous communities in the Arctic and low-lying island communities. But as we all know in this audience, ecological grief is all around us. In fact, we've written a whole book in which the first half of the book explores the many different ways that human-caused biophysical changes are threatening each dimension of health. Happily, the second half of the book is all about the very rich terrain of solutions. So fundamentally, planetary health science is revealing that we can no longer effectively safeguard human health and well-being into the future without stabilizing and regenerating our planet's natural life support systems. But if that is our diagnosis, what's the treatment? Again, we need to move further upstream and think about root causes. Our house is on fire. We can't continue on our current trajectory without undoing the health and development gains we've seen over the past century and threatening the future of humanity and indeed all life on Earth. We have to find a different path. To stabilize natural systems and safeguard a livable future will require deep, rapid structural shifts in how we live in order to dramatically reduce our total collective ecological footprint, a shift that some call the Great Transition or the Great Turning. This great transition has many different elements. There are clearly enormous opportunities for innovation and technology across the energy system, the food system, the circular economy, the built environment, all of which can decrease our ecological footprint while we're meeting our needs. There are huge opportunities to think about finance and investment sectors and think about how we create principles for lending and investing that are consistent with a livable future for humanity. Enlightened policy is actually starting to crop up in many places around the world, particularly in Europe with the European Green New Deal, and in cities where municipalities are coming up with new approaches to thinking about governance and policy. But I think innovation and technology and policy may not be enough. One of the things I've been thinking about a lot recently is that under the ecological crisis and the global health crisis that it is precipitating, we're dealing also with a spiritual crisis. How did it become okay to treat our oceans and our atmosphere as gigantic garbage dumps? How do we sit passively by as our collective actions wipe entire species off the face of the earth? When did the awe and reverence that so many of us feel toward the natural world lose their agency in guiding our decisions? As I think about root causes, increasingly I think that we have a crisis of narrative. We've told ourselves a story of human exceptionalism, of extraction and domination. I think we need new stories about our relationship with nature and with each other. Stories of interdependence, regeneration, and renaissance. These questions of the spiritual dimension of the moment we're in and the role of narrative are what the Constellation Project is all about that Terry and I were going to be speaking about this afternoon. At the heart of this really exploding field of planetary health is the Planetary Health Alliance. Including over 300 organizations in over 60 countries, it is the central organization at the heart of the field, and it supports dissemination of new research, the development and curation of foundational educational materials, and the bringing together of communities of practice around the world. It also helps to mainstream the field's new insights and frameworks into the domains of policy making, the private sector, and the public. And we're seeing huge uptake, as Terry mentioned in her introduction, in all of these areas over the past year. Finally, we focus on mobilizing the global health and human development communities to carry the message that the Earth crisis represents an urgent humanitarian crisis, and to build activated global constituencies committed to rapid structural shifts in how we live in order to reduce our ecological footprint and secure a livable future for humanity and the rest of life on Earth. While most of us in this room are already convinced that we need to address the Earth crisis with urgency For its own sake, the planetary health field brings a powerful set of evidence-based arguments to bear that we also need to address the Earth crisis if we want to have a livable future for humanity. Hopefully, this brings a much broader constituency and additional urgency to protecting nature, to protect ourselves. For now, I invite all of you to join us at the Planetary Health Alliance to learn more about the field and to participate in our community. Thank you so much.